I loved anatomy. I loved what the body could do. I loved when it didn't work and understanding why it didn't work. And then as I got into medicine, I found that I loved taking care of patients. I met someone who was a peds and adolescent gynecologist and found that her job was exactly what I envisioned for my perfect career. My specialty is pediatric and adolescent gynecology. It's care for young adults and young girls in pelvic anatomy and gynecology space. The most common patients we see are young girls and young teens who have started their period and realize that what they're experiencing is not normal. Maybe they have excess pain or more bleeding than they would expect. Those are conditions that really can sometimes get missed. And so it can sometimes take a while to come in for a visit, but that's kind of the most important visit we have, is figuring out those period problems early and figuring out ways we can treat them. Most of our visit is actually counseling and discussion, unlike a traditional adult gynecology visit where you can maybe be expected to have an exam, a private exam. That's something we don't usually typically do in the pediatric and adolescent space because it's not necessary. A lot of conditions, especially the menstrual conditions, significantly affect quality of life. They lead to missed school days, difficulty focusing, missed activities, and we want to talk about the treatment options that can get kids back to being kids. We talk through different lifestyle modifications, different pain management options, hormonal treatment options, things that are safe and effective for the adolescent population. We create a plan A, plan B, plan C of how we're going to help treat these patients, and we create a plan that involves the patient and the parent. Most of our visit is spent with both the young adult and the parent, but we do often do a private visit for the young adult so that they can ask questions that they might not feel comfortable asking in front of their parents yet. It gives them a safe space and feel like they have ways that they can ask private questions and feel like they have a trusted relationship with their gynecologist early in life. One of my favorite parts about my job is the opportunity to empower young girls, teens, young adults to really take full charge of their medical care and play a starring role, building great relationships with the kids, helping them understand their bodies, I think is one of the most rewarding parts. When I'm not at the hospital, I would say I love to travel. My husband and my son and I love to travel both around the country and internationally.